Well, my name is Judy Bedard, and I am a registered nurse, which is the Director of Nursing and Staff Development at Baptist Hospital in Memphis, Tennessee. It's part of a 15-hospital system, Baptist Memorial Health Care, and we've been in the simulation journey for about 8 years. My responsibilities are not just simulation, it's all nursing development, but simulation is my favorite. And I just can't think of any better way to learn. One of my favorite questions to ask people who are opposed is, why is it okay to practice on patients? You know, when did that become the norm, and when did we start saying that it continues to be the norm when there's so many effective methods? So to me, that's the most positive part about simulation, is the patient benefits from everything that you do. So it's worth the effort, it's worth the time, and the outcomes can be amazing. I think why is because the passion that I have for simulation, talking with Rusty and then Mike Inc., and being such an advocate for the patient in simulation. I'm going to talk about the clinical components in the hospital as far as the impact simulation has on patient safety. And I don't think it's been very well explored in the literature. It's extremely well documented in the collegiate environment, in the military environment, but the hospital hasn't done a whole lot to talk about the impact that simulation can have, and I think it's really important. Some of my facilities in the system that I deal with are still having that same issue of how to validate simulation through the eyes of a patient safety component. So understanding the impact, understanding that we can make an impact, and where we came from and where we are today and then where we're going to be going, to me, is part of the focus of my speech, of how people that are looking for the use of simulation in hospitals can justify it through patient safety. My hopes that, you know, the patient will no longer be the training environment, that the arena will be simulation, that simulation will be used not just for ACLS and BLS, but will be used for basic skills, basic competencies, team training, that when someone comes to apply at a hospital, they're put in a simulation room and you see exactly how do they practice, what are their strengths, what are their areas of opportunity, and that we provide a safer and safer and safer environment for our patients. My ultimate goal in 5 years is you never have a healthcare provider say, I've never done this, I've never seen this, which was a standard thing for a long time. Now you go to the simulation lab and you practice and you practice, and you don't have to worry about not seeing it. You can go create it, and then you can go take care of the patient.